Janet, thank you. Florida has now surpassed New York as the state with the second largest number of coronavirus cases. It's also one of the many states where testing is a major issue. The U.S. now tests an average of roughly 850,000 people a day, but some experts estimate that that number should be around 4 million. Our lead national correspondent, David Begnaud, joins us from Florida. David, is the state able to keep up with the urgent need for tests there?
Not as much as they'd like to. That's why the feds have stepped in. The feds opened up 5 surge sites, as they're known, here in South Florida. And the idea is this one, for example, where we are, you drive up, they give you the swab, you stick it in your nose and swab yourself. Then they're going to send it off to a private lab in Kentucky. They're bypassing the LabCorp and Quest folks who are taking 7 to 10 days in some cases to get results back. And the hope is, in this case, you're going to get it back faster. That's the hope.
I'm never going to be happy until we have this under control.
This is Admiral Brett Giroir. He is the White House Coronavirus Task Force member who is in charge of testing. He says the average wait time for test results is between 4 and 7 days, and he acknowledges that is just too long.
We have enough tests right now if we use them in the right way to achieve the goals that we need to achieve.
Some testing sites around the country are still struggling to meet the demand, while some labs have taken more than 2 weeks to provide results. In New Mexico, the governor, who is a Democrat, Michelle Lujan Grisham, has placed much of the blame on the federal government.
There is no national strategy. I still spend most of my days chasing testing supplies for our state.
Maryland's governor is a Republican, Larry Hogan. He's calling for more federal assistance for the private testing labs.
It's starting to feel like it did back in March and April, where everybody was overwhelmed.
Take a listen to Dr. Ashish Jha. He's the director of Harvard's Global Health Institute.
We have not enough staff to run a lot of these tests. We're running out of swabs again. If the federal government back in February or March had decided to take testing seriously, we would have built up adequate testing supplies.
Katie Evans says her husband, Kevin, ended up at a Delaware hospital with the virus 6 days after he was tested. But on the same day he was admitted to the hospital, Katie got a call from state officials. Katie says the results for Kevin and one of her daughters were part of a group of 12 tests that had been mistakenly labeled as negative.
Had the hospital not reread his results, I would have received a phone call saying that he was negative. I mean, who knows what would have happened then? It could have been so much worse.
What a story. Good news is Kevin is out of the hospital and at home resting this morning. He's doing much better. Listen, the Vice President Mike Pence is coming here to South Florida, Miami specifically, because there's a brand new vaccine trial that kicks off today in combination with the National Institutes of Health and the drug company Moderna. There will be 87 sites around the country, 30,000 people who are participating in a vaccine trial. Again, that gets started today, Gail, and we just found out the first dose was administered in Savannah, Georgia this morning.
Yeah, we need some good news this morning, David. I'm so glad Kevin's story had a good ending. As I was watching, I was thinking, uh-oh, this can't end well, but I'm glad it did. And we just can't seem to get the testing right. Still so much more work to be done. David Begnaud, always good to see you.